My name's Dr. Nik Whyte. I'm the co-founder and managing director of the BHPN. We're going to be having an amazing panel with leaders in the field, not just in healthcare, but also in technology. So let's welcome our panel to the stage here. So I'm going to introduce our panel here. So we have, to my immediate left, Dr. Sharon Warder, who's a leading voice in obesity medicine and inclusive care. Dr. Noah Crampton, who's a family physician and the co-founder of Mutual Health, which is a reimagining access and delivery through virtual care. Sharon Auma-Ebnyat, who is an AI strategist advising global health leaders on digital transformation and tech strategy. Stacey Ann Berry, who is in public policy. She's an expert and a founder of B Stellar Group. And we have Douglas Carter, who is Senior Vice President of Technology here at CIBC, bringing a vital perspective on leadership, innovation, and equity in the tech space. All right, so my first question is for Dr. Wharton. So, Dr. Wharton, can you tell us how has technology helped you in your research in diabetes and in obesity medicine, and what technologies are you currently using?
Great question. Really great to be here. So right now in the field of medicine, a lot of AI is happening, as you guys know. So what we're currently doing is I am using a AI script writer. And so it is a transcriber. So what I'm able to do, instead of typing out my own note or having somebody, oftentimes I'd have one of the nurses or a bariatric educator, diabetes educator sitting next to me, typing out all the details of the conversation that I actually had with the patient. Now I'm able to actually just talk to the patient, have a compassionate conversation that's able to go all over the place. It doesn't need to be structured and organized. And then the AI listens to the conversation, turns it into a full-fledged medical note, not a transcribed note where it's every single line, but puts all the past medical history into one spot, and then the assessment and plan into another, and then the physical examination into another spot. Even if I did the physical exam in different areas, or I talked about the medications at 6 different spots, puts the medication all into the same spot. So that's a tech that is not difficult to do anymore. It was amazing when it happened, but it's now relatively easy to write that code and to do it. The next steps are going to be AI talking to my patient and asking them all of the initial questions before I walk into the room. So how did you do over the past couple of weeks when Dr. Wharton initially told you da-da-da-da, and it gets all the information, how did that make you feel, and et cetera, puts it all into a note, and then I come in and have the conversation afterwards. AI is also now, we're using it when we write a prescription for a patient that could be a complicated one, and the patient wants to talk to somebody. There's a tool where they can use on their app and type in, I'm wondering about the side effect for this and this medication, or am I going to lose a lot of muscle mass as I'm losing weight with this medication? Well, tell me about your concerns. Oh, this is what's going to happen. This is and it's been informed by physicians. So that's another. It's not a replacement, but it's certainly an enhancement of what physicians are currently doing. So it's an exciting time.
Great, wow. And I can imagine that just makes things so much easier and makes you able to connect with your patients on that deeper level.
Yeah, exactly. Instead of typing and moving away from them and not facing them in the eye and saying, wait a minute, I just got that down. Or let me dictate it in a dictation machine. You're having a normal, appropriate conversation that the patients want and need. They need that connection. And now we're able to do it without being worried about the accuracy of our note, because you're only as good as your note as a physician. The interaction that you've had is super important, but the college doesn't care about that. And the law doesn't care about it. The judge doesn't care about it. They only care about the note. If it's not good, if it's not accurate, if it didn't say the things that happened, if you did a whole lot of things and a whole lot of transactions and it was really a rich conversation, but you didn't record it and it's not in the note, it didn't happen. So from a medical legal standpoint, this is going to change things. And that's why doctors were always turning and typing. You're like, can you talk to me? Can you look at me? I'm sorry, I got into the note, or else I'm going to jail. So So now we can talk with the patient and still have an accurate documentation of every interaction that happened in that room.
That's great. And I actually remember when I was a resident, I worked in Dr. Wharton's clinic. He had an entire team of people. Their only job was to write the note. And so you can imagine the dollars that are being saved. Well, this segues into Dr. Crampton. So Dr. Crampton, you've actually created an AI scribe tool. Can you tell us a little bit about that tool and how it's changing the landscape of healthcare in Canada?
Yeah, and thank you so much for having me today. We started this at my company, Mutual Health, before ChatGPT came out. So I was sort of like on my own, talking to people about what AI could likely do in the near future. But nobody believed me at the time. Everyone thought this was like pie in the sky stuff. And then obviously it's sort of the world changed in a flash. But we laid the foundation by starting early to know what are the appropriate privacy, security, regulatory compliant processes that need to be in place. So as a small startup, we had very meager resources, but we had a lens towards that as well as integration into a clinician's existing workflow. And that was so important because the long-term view is that AI Scribe is solving sort of this obvious pain point that you just described of the burden of clinical documentation. But really, we want AI to be our assistant in the provision of care. It's so important that we use it to its full potential, not just for note-taking. So we've got to get it slotted in at that perfect sweet spot that all the key stakeholders buy in: physicians, patients, administrators, etc., so that we can layer on top of that the ability to ingest pre-visit information that you just talked about, or suggested best evidence that the AI has scanned the entire evidence playbook for, that we as clinicians could never do adequately. So there's just so many opportunities to have a co-pilot. I know that term is used to death, but it is a good sort of symbiotic term about how clinicians can actually use AI to its potential. And that's how we've set the foundation for Mutuo and AutoScribe.
That's great. Thanks for that. And obviously, with the use of new technologies like AI, there are inherent risks. So Sharon, can you maybe share with us, in your role, what are you seeing as some of the real world risks with these technologies, and how are hospital systems changing to adapt? What kind of structural changes are you seeing within your work and the organizations you're working with?
Yeah, thank you, everyone. The biggest risk I'm seeing that's like the next nightmare for hospitals is with medical devices. So we see a lot of hackers really getting sophisticated now, and we've seen a lot of the rates of hacking that's happened. And the way that hospitals can really prepare themselves is in your clinical engineering departments, those need to be integrated with your IT. That's an increasing trend that a lot of organizations are following. So you can have full visibility of all devices. So now a lot of IT has anything with an IP address is IT's responsibility. And then on top of that, having a zero trust security framework in your organization where no person or device is given automatic access to any networks or systems. And then making sure that you also have devices that are legacy devices that are older, that are not on cloud and are not cloud-based, and making sure that there's network segmentation. So separating those away from the other networks with strict protocols and making sure that happens. But it's beyond just a technical issue. It's also a leadership issue where we're seeing a lot of the need for CIOs, your Chief Information Security Officer, your CMO, needing to be at the same table, talking about digital risk as well as patient safety.
Wow. So, you mentioned medical devices. I mean,
Yes.
Can you give a real world example? Like how are they're hacking into a medical device?
Yeah, so an example would be like infusion pumps. Those are like level 2 devices that are typically targeted. And one of the manufacturers actually did find a loophole in some of the older infusion pumps where they can actually meddle and play around with the dosage. So can you imagine in clinic, if somebody's getting an infusion and somebody hacks the system and is able to play around? So it not only compromises the network in the hospital, but puts patients at risk. So a lot of regulatory bodies in North America and Europe have actually started having strict protocols around the manufacturing of devices. So before anybody brings devices to market, they have to have cybersecurity protocols embedded in their devices, because the older devices do have a lot of unpatched and loopholes that actually can give them access. And this can be a really big nightmare for hospitals, considering the average hospital bed has like 10 to 15 devices attached to a patient. So you can imagine, like in an ICU, what that would look like. That would be pretty chaotic for a hospital.
Yeah, that's definitely scary. And, we've heard of people holding hospitals, hostage, basically demanding ransoms when they've hacked into these devices. Stacey Ann, can you maybe tell us a little bit about some of the work you've done with AI governance and with policy? And can you talk about the importance of ethical responsibility and eliminating bias in AI, as well as representation in how we are creating these AI tools?
Certainly, and good evening, everyone, and thank you for having me. So my background is public policy, but I'm also in the world of lobbying. And part of what's essential, especially for our community, is to make sure that we help to shape the AI legislation. Like, we talk to our elected officials, we speak on the different committees. There's a health committee, there's a science and technology committee where we present, research from, doctors so that we can shape the policy. So part of what I advocate for is making sure that there's a human-centered lens in AI policy. We don't want to lose sight of having humans in the entire AI life cycle. So there's like the 3 stages: the design stage, the development stage, and the deployment stage of AI. And during those stages, you want to make sure that you have accurate data. You want to make sure you evaluate the data and making sure that there's no biases, because AI can determine who gets access to treatment and when. And there's a lot of examples of how it has been causing harm, specifically in healthcare. So one of the examples would be the pulse oximeter that doesn't accurately read the oxygen levels in people with melanated skin, because of the light sensors in our skin that's dark absorbs that light. But there is some breakthrough that I recently just discovered in preparing for this panel, where earlier this year, the Food and Drug Administration in the United States is now using the Monk Skin Tone Test Scale, which was invented by Dr. Ellis Monk. He's a Black professor at Harvard. And so he's now expanded the skin tone metrics that the FDA has required to be used for that.
That's great. I mean, we know that having representation is so important when we're creating any type of new tool or new technology. So, Douglas, you are the chief guru of technology here at CIBC. Can you tell us a little bit about what your role is? We know that that the financial sector has been ahead of healthcare when it comes to AI. Tell us about what you're doing here at CIBC.
Yeah, so as Akil said, I was a chief guru. I'm not quite the chief guru, but when it comes to the actual code, but I am the chief guru when it comes to the infrastructure, some of which Sharon just admirably described about what would keep me up at night. So I run the technology infrastructure my team runs the technology infrastructure at CIBC, which includes all the tech in this room and in this building, in our trading systems, in our banking centers, our loan systems. You walk up to an ATM, the technology that's behind all that, that's my team runs the technology infrastructure for all of that. And a couple of the things that Sharon talked about zero trust and security, we have to embed in the design and in the operation of how we run those systems. When it comes to AI, everything that Stacey just said is core to how we operate AI at CIBC. We've used AI for a very long time in risk models. And if you pay attention to financial markets, you hear about credit risk and loan risk. Well, we've had AI running those models, helping us to make decisions about all of those things for a long time. What has changed is what we now call generative AI, Gen AI, which now includes what we call large language models. And that's where, to Stacey's point, we have to have representation embedded in those large language models. Here at CIBC, we're next week, Tuesday, as a matter of fact, we're about to roll out something we call CAI, short for CIBC AI, to all 47,000 of our employees. We've been having it in pilot for about 6 months now. We have it in our contact centers. So if you're a person that phones up and interacts with us, we have AI helping our agents provide a better experience for you, because we'll use all the data that we have about you to make sure that we know who you are. If you ask a question, we're going to give you an appropriate answer. My friend Akil, his team, as he runs on the Ontario banking centers, uses all of that. We're about to use that with all of our allow that to go to all of our employees. Some of the things that Sean talked about collecting notes. I know Monique Rowe is here, and she's an Imperial Service Advisor. It's going to help her to do notes in a much faster, easier way, so she can spend less time writing notes and more time thinking about the financial advice that she's giving to our clients. And the most important thing for us, though, is the governance of that. Our regulators, there's two things. The data, a lot of it is personally identifiable information for you guys, what we call PII data, information about you. We've very strict rules about how we protect that data, who has access to, ensuring that we know who has access to that data. When we use it within AI, we have to actually be able to explain to a regulator and to our own governance teams how that AI works, how the code works, and if we can't, we don't deploy it because we have to be able to stand behind it and explain exactly how it works. And that's how we ensure that we have the right representation in those large language models for the solutions that we build.
Excellent. Wow. So, amazing. It sounds like you're, ahead, certainly of the healthcare sector when it comes to some of this stuff, but we look to catch up for sure. Dr. Wharton, can you maybe talk briefly about what you might see as the biggest opportunity in healthcare research with some of these new technologies?
Yeah, so I run a research facility which does some of the international trials. So a lot of the obesity and type 2 diabetes research that you guys may Google and find out about, from the Ozempics and the Wegovy's of the world and the Mounjaros, the Zepbounds, a lot of those trials occurred here in Canada, or some of it, right? They're international trials from Germany to South Africa to Australia to America. And one of the centers would be one of the centers here within Canada. Those trials usually cost around $500 million to $1 billion. One trial, $1 billion, up to $2 billion. So they're big deals, and they're expensive, and the centers do really well because it's a good business, and it's a good business for Canada because we get to stand on an international stage and say that we were part of this clinical trials. Our patients were involved in determining whether this medication works the way it's supposed to in this medical condition. So at the current time, there's a number of tech things, particularly things like the continuous glucose monitors. I mean, you guys have kind of all heard those. You wear them on your arm, and you get to see what the glucose is on a ongoing basis. A number of tech wearable devices that will end up helping us to understand how things adjust on a ongoing basis. There'll be some new things within muscle markers to see what the strength is of the muscle as a person changes their weight, changes their diabetes risk factors. So the hope is that more and more AI comes in, not to replace. It's a very still person-driven workforce, and we like it that way. I'd like to keep my employees employed. They're useful, and it just adds richer. They're useful, guys. I'll let them know that they're useful. I thank them. So I do think there'll be more AI, but it's going to give us better information for the patient care.
Just to add something there, what you just said about there'd be more AI. Someone once said that a professor, because a lot of AI, Gen AI stuff grew up here in Toronto. He said that the worst AI you'll ever experience is the one you're using right now. So I understand that. It's changing that fast.
It's always changing. And Dr. Crampton, I'd like to get your thoughts on where you see AI taking the healthcare system here in Canada over the next 1 to 2 years.
1 to 2 years, that I could foresee. Beyond that, it starts to get a little bit scary to think about what might happen. But it's scary in a good way. Like, it's exciting. AI is here, something to wrap our head around. But we are going to have major disruption to the entire economy. Like, let's be honest. AI is a transformative technology for everything, including healthcare. For the next 1 to 2 years, that's what I'm, personally passionate about. The representation in the data sets issue, I think, is going to be something that becomes more and more key societal objective. I think that, the more voices we have around those large language models meeting certain levels of acceptability on that front, the better. But what I'm working on is again, coming back to those co-pilot features I was telling you about. If you think about it, both from the patient as well as the provider level, between visits, there's so much opportunity to, health coach the patient using an AI agent that's reinforcing good behaviors and, the social determinants of health. They could, engage in things that sort of improve those aspects of their lives. And at the provider level, both on the admin tasks as well as the clinical decision support tasks that they have to do, AI could be surfacing, next best steps based on their database of what would make sense based on all the data that it's trained on. So you can get more efficient care, more effective care, and hopefully, reduce some of that level of burden on our current health system, both burdened emergency rooms and the amount of resources that we have in our health system. There's an opportunity to use AI to start reducing that curve, hopefully. We'll start to see early signals of that in the next couple of years.
That's great. So it sounds like more empowerment, even for the patient, and more data points between those visits. That really would make a difference. Stacey Ann, can you maybe tell us, a little bit about how does that happen at the government level? And how do we ensure that there's, more representation when these conversations are happening about making these policies?
And we have some challenges with that because of our election cycle. So the federal government was going in the right direction where they have drafted the great, AI strategies, the pan-Canadian artificial intelligence strategy, even modernizing our healthcare. So I think it's Bill C-27 and B-72 were the legislations that were on the books. But because the election was called early, those legislations actually died on the floor, which means they have to go back to the drawing board. But there is some hope because the new administration has now named the official Minister of Artificial Intelligence. And so that's showing there will be a priority on developing AI. So again, just to emphasize those opportunities to participate in speaking at the different committees that's relevant to the legislation. Also exploring opportunities to be appointed to the boards, agencies, and commissions. So many years ago, I had the opportunity to serve on the Toronto Board of Health. I did a term there, and this allows people from our community to kind of provide our lens, that equity lens, and the lens of inclusion that's more needed when decisions are being made with City Council, the Chief Medical Officer of Health, Eileen DeVille. I had a privilege to work closely with those professionals in our healthcare system. So now is the time, especially when there's like a new government, to really explore those type of opportunities where you can create an opportunity for yourself to have a seat at the decision table. I find too often many people in our community shy away from those kind of boardrooms, we feel, because we don't see ourselves there, that we don't belong there. And I always try to encourage people to say, go where you don't see yourself represented, but also don't go alone. Bring someone who is also not at the table with you to these tables.
Excellent. So Sharon, I know you've done a lot of work in the US and in other healthcare systems. What vulnerabilities do we have here in Canada that we need to be aware of, and in Ontario in particular?
I would say that, the technology in healthcare is moving at a faster rate than the hospitals are able to adapt. So a lot of hospitals are functioning on old infrastructure. They have fragmented vendor systems. They have vulnerable connected devices. So it really puts a lot of healthcare organizations at risk. Like I talked about the hackings that are happening, but also one thing that's happening and that, you need to be aware of is the role of a CIO is actually changing and has changed over the decades. So, in the 80s and the 90s, the CIO was a trusted operator, building systems, maintaining systems, and, working behind the scenes. And then in the 90s and 2000s, that role evolved further where they were an operational partner, working with executives, and then making sure that they were engaging with digital transformation projects. And so from 2020, which is a time of automation going forward, the CIO has been pushed at the forefront to be the digital strategy lead for all things digital, because all of healthcare now is pretty much digital. So with that, the CIO roles are changing, where now they have to be accountable for all the AI initiatives that are happening in the hospital. They have to actually lead and report to their boards about that. And then they also have to make sure that they're guiding all the care that's happening in the hospital as far as technological support, cybersecurity, and making sure that it's actually like ethical at a big pace. So it's really important to know that piece and understand that, there are different leadership roles that are also evolving as a result of that. And you're going to see a shift as well, where you have chief data officers, you have chief AI officers. And so the key here for a lot of people, and I implore all of you, is don't be at the sideline and watch the technology evolve. Really get involved in, like Stacey Ann mentioned, go into these rooms, and even in your clinical practices, just making sure that, as your hospital is developing any technology, make sure you're in the working groups, you're in the committees. Like, that's where we're lacking a lot of people, and that really can set us behind. So we can't be spectators to the technology. We have to participate and even just try it out, and really making sure that the business is growing.
Great, thank you. So Douglas, any words of wisdom for us healthcare professionals based on what you've seen with the digital transformation in the financial sector?
Yeah, you have to pay attention to the governance. Our regulators are nonstop on us about everything to do with how we're managing the data, how we're protecting it. And for my space, it extends into the actual infrastructure that provides the compute and storage for all the applications. I have to make sure that those things are secure at all times and current. And I think, if the hospitals are struggling with that, then that becomes a weak spot. And I think healthcare data is even more important than financial data. That I think is something they need to focus on. And just one other thing is that it occurred to me as we were talking about there, and you're talking about where AI is going. Our biggest constraint isn't actually how AI is going to develop. Our biggest constraint is going to be the power that we need to operate the data centers, run all this AI that people are going to need to stay modern and current. We all are pretty fortunate because we live in a country that's got lots of water. And we've got some of the biggest rivers and waterfalls in the country, in the world. That's why I think the people down south are looking up here, my personal opinion. But if there's a thing that you want to do, is pay attention to hydro and power, because we need those to not only run the data centers, keep them cool, but run the tech that we need to develop the AI as it goes forward.
Yeah, that's great. And it is really the infrastructure is so important. We forget about that part, but there are actual physical pieces of equipment that are instrumental for all of these things to happen. So lastly, as we wrap up, I just want to ask each of you to quickly comment on or give us your thoughts on, as healthcare professionals, as business owners, what's the most important thing we can all do to stay involved and to have a competitive edge moving forward, given the technology and the advancements? Maybe we'll start here with Dr. Wharton and go this way.
Yeah, I don't know.
It's a valid.
Honest question. Honest answer.
It's rough, y'all. It's rough. It's actually tough. So this is interesting because I'm a big Prince fan, and Prince went out at one point. He was talking to this high school, and this is like 15 years ago, and he said to them, "How many of you have apps on your phone?" And it's cool. So how many of you have downloaded an app? And they're like, "Man, Prince, you're old. Download an app. I download an app all the time." He goes, cool. You guys got downloaded an app. How many of you have uploaded an app? Then everybody was quiet. All those high school kids were quiet. He's like, and it was at a black high school. He's like, if you don't learn how to upload an app and make an app, we're going to be left behind. So we need to recognize how to do what Douglas is doing, how to understand what he's doing, how to do it in our spaces, whether you're a physician, a physiotherapist, whether you're healthcare, whether you're in finance, whether you're an entrepreneur, be part of it. And it's moving so fast. If we get left behind in the governance and the policies make a difference. Systemic racism is based on policy and law. That's what systemic racism really means. It means it's governed into the system and you can't get away from it because someone has a law that says, well, you can't live here because it says it in the law. So that's what systemic racism actually is. And that can happen in AI and with the technology that's happening if we're not aware and if we're not uploading ourselves.
Great points. Dr. Crampton?
Yeah, I think it's good to build on this theme because it's so central to one of the big challenges of our time. I'm a physician, but I'm here as the CEO of my company, and obviously my company is in the business of providing a service to physicians so they can provide the best care to their patients, and I'm dependent on the big tech large language models that were trained on the entire internet and all the biases that were built therein. And so we're going to get the benefits from those models for sure, but I calibrate as much as I can as a downstream user of those models for the lack of representation in the data sets. But I'm limited. And so going to your point about governance and what's possible here in Canada, culturally, we represent like a good microcosm of the world in terms of different cultural communities and, how they want to be represented amongst, key data sets. And so the Black community, of course, is central to that. And I think there's a real opportunity in partnership between Canadian industry, the healthcare system, and patients and the advocates for cultural groups among patients to design a new large language model that adequately represents us and Canadians in a way that will get the best patient outcomes. So as an industry provider of that, I will give the best product to my client, and they can use it to deliver the best care to their patients. And I think if we can be advocates for that model rather than having to depend on Silicon Valley forever, that would be really powerful.
That's great. Douglas?
Yeah, so I mentor a lot of students, a lot of high school students, and we have a lot of co-op cohorts that come through CIBC on a regular basis. And they always ask me for career advice. And I'm going to give you the same advice I always give them, because what I've noticed with them, and I've been around a lot of them as they work on things with us, especially when we do hackathons and they come up with these wild and crazy ideas, is be curious. Be curious about what technology is going to do for our community, and be curious about how it works, and keep asking questions. Because if when we ask the questions and about how people are building the solutions, how they're deploying them, who's involved in the testing, then there's an opportunity for you to figure out whether there's a place for you to make a difference in it. And I think, and especially in healthcare, much more than financial services. I think because of our history as a people, in all over the world, how healthcare is deployed. So I think be curious and ask questions, and every time you see something, ask why. In tech, we have this model about when something's broken and we need to figure out why it broke. We ask why 5 times. By the time you get to the 5th why, but before you get to the 5th why, you usually find out why, and you can fix a systemic problem. Be curious.
Great. Stacey Ann?
Yeah, so I definitely agree with my fellow panelists, but I would also add to also ask those critical questions, because that's what sparked my interest in like tech policy. I almost landed into this thing. And so I was asking, who are we helping and who are we hurting with the kind of technology? And it really started with me looking at the intersection of technology on our human rights. When it comes to our actual biometrics, we're seeing facial recognition in airports with no real consent as to whether or not we want to use it or not to board a plane. And if the facial recognition does not accurately identify people with dark skin and then flags us and misidentifies us, then we're going to have issues with traveling. And so we want to like explore AI. We want to be curious, but we want to also keep on our critical thinking hat, because we don't want to be just consumers and subscribers. We want to be the builders. We want to be the creators of AI technology as well. And so also I want to encourage everyone to just do some upskilling, like become more AI literate, where you can learn more about how AI actually works, really doing some deep diving on the ethical AI principles and the good governance. You can find this on the OECD website. You can find this at the Center for AI and Digital Policy, of which I'm a member. I also created a course on AI governance, policy and the public good with Udacity, which is available for everyone to take. So, try to find your place in it regardless of your background. We need people with the multidisciplinary approach and different lens. We need people who are users of AIs to participate in the public discourse, because right now the narrative is very one-sided. It's a lot of the big corporations and big tech controlling the public narrative that we hear about AI. We also need to think about its impact on the environment. There's a lot of environmental impacts as well, and to explore those things. And so that's what I want to leave with all of you today.
Great. And Sharon?
Yeah, the one thing I would implore you to do is to pay attention to how clinical treatment of patients is changing. So, recently the NIH in the UK did start testing an AI tool that has the capability for early detection and predictive analytics for diabetic patients. So they use ECG data that can actually predict type 2 diabetes 13 years before the onset of symptoms. So there's going to be a big shift in healthcare where instead of focusing on just diagnose and treat, now you're really going to have to start looking at how do we predict and prevent, especially with chronic diseases that are prevalent in Black communities. This is really huge for us. So pay attention to that and try to get involved once that comes to Canada and these tools, because we also have to look at the data that they're using and making sure that it's representative of us and is actually able to help us better predict and prevent these chronic conditions. So stay abreast of how your clinical practice and disease management is being developed and evolving in technology, because it'll change the way you practice medicine in the next 5 years.
Yeah.
Great. And, I will just say as well that my recommendation is that we use AI as much as we can in our everyday lives. Like if you're writing something and you're not using AI, then you're not using the newest technology. So you really need to force yourself to adopt. Stop Googling things, start using ChatGPT-4. If you're going to make something for dinner, you can actually take a picture of it and it will give you a recipe. So just trying it out will help you understand the technology much more. Well, with that, we're going to bring this wonderful discussion to an end. I want to thank all of you for coming out. This has been an amazing panelist discussion. Remember, we do have an after party happening tonight from 9 to 11. And if you haven't got a ticket, you can purchase that on the way out. Some of our panelists will be here. So if you have more questions for them, for sure, don't be afraid to, give them a nudge and ask them. Let's give a big round of applause to our panelists. Thank you.